Hi, I'm Dr. Nilam Khurana and I am a general pediatrician, and I've created this video to help providers understand what I have learned about dyslexia. So most of you will know in pediatric residency and any training that we get, we don't learn anything about dyslexia. I've actually even looked into asking developmental pediatricians, and there's very little education for providers on what to do with dyslexia. And then of course you have the kids that come in and the parents say, my school told me that they need to get a diagnosis of dyslexia from you. And you say, great, I can't really help you. I'll send you to this neuropsychologist who's going to cost $2,000 to $3,000 if your insurance doesn't cover it, and good luck. So I've learned a lot about dyslexia because I found out that my daughter had it when I didn't find out until the end of 4th grade that she had it. And it's just such a crazy thing. You think that it would be pretty obvious, but then when I realized that it was not so obvious, as a general pediatrician, it took me that long to figure out that she had it. I realized there's so many parents that are struggling and there's a lot of education that is needed. So this is sort of a quick tutorial on what I've learned on dyslexia. I'm definitely not an expert on it, but it's more just so that we can help other providers understand what to be looking for, and then also to give you an idea of where we're going and what we're doing. So we're trying to do a screening questionnaire for kids at 6 years of age to start with that will help parents understand the signs that kids can have if they have dyslexia. There's a lot of things going on with the school systems. People are teaching all the teachers about the signs to look for as well. And so in the medical field, if we just get more education, we all end up working together to get that early diagnosis for dyslexia, it's going to help them a lot, because learning to read and write, I call it hieroglyphics. It's not like we have a place in our brain for those hieroglyphics. We learn them. It's not something that we've always had to know. We've had to create a place to put those two-dimensional items in our brain and be able to retrieve it easily to then be able to read and write. But children with dyslexia end up having a difficulty with the 3D versus 2D. And so that's why they end up flipping their B's and D's and P's and all of that. So there's a layer of problems that they start with. Some of them will have the phonemic awareness issue where they just don't understand that phonological processing and they have articulation disorders. And then once they get past that part, then they have to actually go to the next layer, which is understanding that sound means this two-dimensional object, and then I have to figure out how to write it and read it. And so it's just that they need to be taught in a different way. We know that we have a general mainstream education for children who learn the same way, and then for those others that don't learn the same way, we have an IEP. But a lot of these kids with dyslexia end up falling through the cracks because what they do is they start guessing by the shape of the word to know what that word is. So they can kind of get by, but then there's different words that they'll end up mixing up, like at and to, T-O. If you flip it around in the air and you just have that little tiny little thing at the bottom of the A that's missing, you can mix those up. And so then when they've memorized the shapes of big words, then they can read all the big words, but they miss the little words in between and they don't actually understand what they're reading. And then it looks like they're having reading comprehension issues. And then it looks like they are ADHD, inattentive type usually, but even maybe hyperactive, because how long is a child going to sit there in the classroom and not be able to read or write and actually focus? And then of course, a lot of kids will end up having depression and anxiety as they're older because they know they're smart enough, they should be able to put this down on paper, but they can't, and nobody understands that their dyslexia is the issue, and they just think it's either lack of ability or lack of desire or lack of motivation or all these different things, and they start believing those negative things about themselves. So what we've decided is we're going to put together this questionnaire. Actually, we've put it together. We're in the process of doing the research, and then we're going to hand it out to kids at the 6-year well visit. And then we're going to do a follow-up evaluation for all those kids, looking at their phonemic awareness, their general nonverbal IQ, to make sure that there's no other IQ related or cognitive related reason that they're not able to process and understand those sounds. And an overall evaluation of reading words and just general speech. So we want to use those areas to be able to say, okay, this person has the ability to understand at an appropriate level. This person has the ability to speak at an appropriate level and process those sounds appropriately and doesn't have other speech delays. This person has the ability to put pieces together, but they have the inability to translate things into a two-dimensional object. So then once we are able to do that, we can really try to open up the doors for lots of kids. And there is treatment. We already know what the treatment is. The treatment is basically teaching them in a way their mind works. So one of the programs is called the Barton Reading Program. I'm probably saying that wrong and then I'll get in trouble, and they have these little tiles that have different colors, and the B is written with a line under it. You can pick it up, you can hold it, you can imagine it. It's three-dimensional. You can put it in your brain and store it in a way that's easy to retrieve, because you can use all those other areas of learning. We know that everybody learns differently, but if you don't have the ability to learn with just that two-dimensional world, we need to provide that for the kids so that they can learn in a different way. And then when they do, they can flourish and have better self-esteem. And then there's another program that they do in schools, which is the Wilson program for larger groups. And Kyrene School District has a great thing where they're really screening these kids early and trying to get all these things done. And the schools are starting to know more, but there's just a lot more that needs to be done. So if you have a kid that you think has dyslexia, you want to get certain testing done to be able to get them diagnosed early, utilize the resources to help them learn using other kinesthetic, audiological pathways to be able to learn their letters and read and write and all of that. And then there's this thing called the Arizona Dyslexia Handbook, which not even all teachers know about, but very few clinicians know about. And it's basically this thing that says, okay, now legally, even if you don't qualify for an IEP because you don't have enough delays, but you have dyslexia, we can provide accommodations for that diagnosis. So that means that if you can't keep up with reading and writing, and we're testing you in math or social studies, but we're really not testing your math or social studies, we're testing your ability to read and understand what the question is and write the answer. That's not fair. So now what we're going to do is we're going to allow you to have oral exams. We're going to allow you to have audiobooks where you can hear the story and process it and learn it and talk about it. We're going to let you have the ability to take notes by using a computer, which is three-dimensional, and you learn where the things are so you can actually do really well with the typing, or a talk to text like they have where you can speak into something and it'll type everything out for you. There's so many different accommodations that you can provide, but it's the first thing is knowing that they have dyslexia. So I wanted to give you guys that information as sort of a little bit of a tutorial on dyslexia, as much as I know, and then just to also help you guys understand the goals of what we want to do in the study, where we want people to be able to help us get those kids early, that early recognition, but also have a little bit more of an idea than we've had since we came out of residency regarding dyslexia, so we can talk more about it to parents so they can understand stuff. And there's lots and lots of information out there, and I can always do another detailed tutorial for anyone who wants to know even more about it. But that's the big stuff that I wanted you guys to know about so that you can have a bit more of a conversation with families as we're trying to ask them to do these evaluations, these screening evaluations as part of their well visit, and the follow-up testing to see if they do have dyslexia. It'll be a great thing once we get it going. And our goal is to have it as a national standard for kids at their 6-year well visit, just like we have ASQs and MCHATs and all these other developmental assessments. At 6 we stop, but really there's so many kids that need it. They say about 15% of kids have dyslexia. So that's a lot of people. So I'm glad you're joining us in trying to help all these kids, and we look forward to working with you guys. Thanks for listening. Talk to you soon.